and wanted to make some videos regarding chronic pain because a lot of people we see here have had pain for years, sometimes decades. So wanted to talk to you a little bit about some of the new neuroscience of pain and how, so I'm gonna geek out probably in these videos because this is one of my jams. Anyway, it's really, really cool, and there's some really cool information behind it and some hope behind it. So bear with me because it's a really complicated topic. So I'm probably going to do 3 videos to start with. And then as we go, if they're well liked and well received, we may go further into, treatment options and things like that. But for the first 3, we're just gonna go through kind of what some of the new advances are as far as our understanding about how pain works. Now, that said, there's still, mechanical things that can go wrong that can cause pain. There's still kinds of stuff, molecular things that don't show up on imaging. All these kinds of things can be a contributor to pain. So keep in mind, when I say neuroscience and, we're talking about the brain and the nervous system, it's not just that, but this is kind of a framework that we can use to help understand our pain and help to understand how to mitigate it, help to make it better. So, so that said, what is pain? Okay, pain is, I think it's, officially defined as an unpleasant experience that indicates some malfunction or, problem within the body or some probable danger occurring within the body. Okay, basically boils down to it's the brain's assessment of how dangerous is this really. Okay, and so, for some of us, rolling our ankle, we've rolled our ankles a bunch of times and we've never sprained it. Not a big deal. Hurts for a second and then it's gone. So it's no big deal. Brain says, no big deal, right? For some of us, we twist just the wrong way and our back just is excruciating. And, part of it is because the last time this happened, we were out of work for 3 years. Or we lost the ability to do some of our favorite hobbies, or made our financials so much worse. Things like that, okay? So the brain is trying to decide how dangerous is this really in terms of our survival, okay? And so it takes a lot of things into account. But this is super, super quick. It's like an optical illusion. You look at it and it's like, bam, the brain makes a decision. Like, you don't have a choice, really. You can't think it through and go, oh, well, this isn't really dangerous because X, Y, Z, whatever. The brain is like, boom, that's a chair. Boom, that's, that's weird. That's an Escher painting, oh, those lines are moving, if you look up optical illusions, you'll see a ton of them on the internet. But so things where lines look like they're moving and they're not, things like that. It's snap, quick judgment. Okay, this is our lizard brain we're talking about. This is our survival brain, not our frontal cortex, the ones we make decisions. So we can't decide if we're going to be in pain or not. Okay. That said, it is in the brain. And so, it's not the doctor saying this is in your head. Okay. That's a whole different, that's like saying you're making it up or you're, whatever. This is no brain, no pain. Okay. Because the brain is making the decision, is this dangerous? And if it decides it's dangerous, it sets off an alarm, i.e. pain. Okay. But the brain is what we call plastic, which means that it's changeable. So it changes with more information. Okay. So we can help to decrease pain by understanding our condition a little bit better. We can decrease pain by understanding that this movement isn't actually causing any damage. Because a lot of times, things are painful because we're like, oh, are we hurting ourselves? Like, are we harming ourselves? If we know we're not, then, that volume gets turned down. So just keep that in mind, as the brain with new information, with every experience, it changes, okay? And so we can use that to our benefit, okay? The brain uses many, many areas, at least 11 different areas, to decide whether or not something's dangerous. So it can, so I highly recommend, there's a video by Lorimer Moseley, that's Lorimer, first name, Moseley, Moseley, and it's called Why Things Hurt. I highly recommend you watch that. It's 15 minutes. He's a super funny guy. He's a physical therapist out of Australia. Highly recommend that you watch that, because it kind of helps you to kind of understand what's happening. But the brain uses sensory information, of course, okay, information coming from the body. It uses our eyes, our ears, smell, taste, anything that might give us a clue as to what's happening, okay? And of course, the sensory information from the body, as far as, is there something getting pinched, or is there, something that's not aligned correctly, okay? It uses, like I said, visual, blood, no blood. Remember when you were a kid and you fell down and you were fine, and then your friend goes, oh my gosh, you're bleeding. And then you start to cry and go home and get all kinds of loving from mom and dad if you were lucky. Previous experience and memory. So like, for example, I use this all the time. If you've ever gotten undressed and see this big bruise on your thigh, and you're like, I don't remember that happening. The memory banks in your brain, it got the information from the body. There's tissue damage done. Got the information from the body, and the brain went, this is no big deal. She runs into that table all the time. Not a big deal. Didn't set off any alarms. Okay. Motor planning, motor planning and coordination. So if you twist your ankle or hurt your knee or hip or low back or something like that, your body has to decide, am I going to have to make significant changes in how I do things in order to work? That the more changes that are needed, the higher the volume of the pain alarm goes, okay? Visualization or imagination. Our brain tries to figure out what the heck is going on. And so if something is happening, like we got a pain in our lower abdomen, and we can't figure out what it is, it's like, oh my gosh, I have cancer, like it imagines all kinds of things, or it will visualize what's, somebody tells you have degenerative disc disease, and all of a sudden, like, you're imagining your discs in your back like desiccating and like crumbling away, and really that's not what's happening. What's happening is that we have less hydration, and so they shrink a little bit, okay? And it's kind of like what happens to our skin when we get older and there's less hydration, so we get wrinkles. Those wrinkles on the inside. But our brain uses the imagination. Like, what do we think is happening? It's the difference between a rotator cuff tear and a pulled groin muscle. Same thing, only just different words. And so the brain takes those words and uses it to fuel the imagination of what's happening. Okay, those, just to name a few. Okay, there could be some, emotional issues attached to it, that sort of thing. But the important take-home message is that the stuff that we grew up with, it's an old Descartes model, meaning there's pain, or there's damage. That means there's pain. You fix the damage, and the pain goes away. That is false, patently false. We know that, and we've experienced it in our own lives. Okay, where we go through surgery and the pain is still there, not the pain from surgery, but the pain that we had before is still there. People who have had amputations, the pain is still in their foot, even though their leg's gone. So it's just not correct. Doctors will often say, oh no, you're healed. And in truth, the tissues have healed. Are they healthy? Probably not. Okay, that's probably where you're getting some of your sensory information from. But you probably are healed. Okay, tissues take about 6 to 8 weeks to heal, 3 months tops. Anything beyond that, pain becomes its own illness, okay? Because we do consider those tissues healed. Again, are they healthy? Probably not, but that's a whole other issue, okay? It also doesn't mean that there's no mechanical or cellular issues, okay? Because our imaging won't necessarily show that, okay? And you can still have a physical component to your pain, even when the doctor says, oh no, you're fine, you're healed, okay? So this means that there's lots of opportunities to intervene, because there are so many pieces that go into this, and I've only covered just a few of them. There's lots of hope. And the biggest thing is that if we can learn as much as we can about how pain works and about our condition, that will decrease the brain's imagination of what's happening. It'll calm our nervous systems down and turn down the volume on the pain. If not, it will at least take the suffering that occurs along with the pain away, not away, or it will decrease it. So the more will be talked about in future videos. Okay. Thanks for listening, and hope you have a great week.